Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a dorsal bunion. We talked about bunions, it's been quite a few videos back. And if you remember, we look at the anatomy here, a bunion is when you get the bone turned out and the toe turns in. And that's a bunion is usually on the inside of the foot or the medial side of the foot. You can also get a little bit different situation, which we did mention, which is a dorsal bunion where the metatarsal is elevated and you get banging when you try to walk. And you start getting additional spurring and additional bone growth on the top of the first metatarsal, so right behind the big toe. So you get motion difficulty in that big toe. There are really three different ways that it presents typically. It can be a true Hallux Limitus, where it's even when they're sitting in the chair, there is some limited motion. You can get motion, but it stops. You can get a severe Hallux Limitus, which becomes Hallux Rigidus, where the big toe doesn't move at all. Or you can get a functional, where it functions fine until they step down on it. As soon as they step down on it, it pops up, and then it limits the motion. Functional being the most common, but functional can lead to a true Hallux Limitus where it's limited motion and so forth. So the idea is you have the metatarsal and it's elevated and you're banging into it, and because of that banging into it, you're limited on that motion. You can't slide past like you're supposed to, and it creates an extra bone on top or spurring on the top of the big toe. So what are the options? It really comes down to where they are in that stage. If you have a functional Hallux Limitus, all you got to do is make it so that metatarsal doesn't get pressure when they stand. So you can do different types of pads, like a dancer pad that allows that first metatarsal to drop, and you'll still get normal motion. A lot of times, if you have a functional Hallux Limitus, they can go into a heel, for example, and because they're putting their toe already past that point, they don't get the limited motion in a high heel. So functional Limitus, you need to give them the motion, at least initially. And there may come a point where you need to do surgery to prevent it progressing down the line. A true Hallux Limitus, where you have the limited motion, typically requires some type of surgery to treat it. Although you can treat symptoms by doing cortisone shots in the joint, I don't usually recommend those because they're not doing anything. They're not fixing anything. They're taking away some of the pain short term until you can get it fixed. But fixing it, you actually cut the bone. You could actually just remove the spur on the top, and it will give you back the motion, but because you're not fixing the problem, it comes right back. So I recommend you cut the bone and you actually move it over and down to give you a more normal functioning of that first metatarsal, which takes that motion back. If you have a Hallux Rigidus, where it's really rigid and it doesn't move at all, there's usually quite a bit of arthritis in that joint. And there are three options. All of them surgery. That's not fair. There is a fourth option. Sometimes you can actually put a certain type of insert in there that doesn't let the big toe move at all. That can help. That is just doing something to prevent motion because they are unwilling or unable to have surgery. But surgery is really the best option for a true Hallux Rigidus, where the big toe can't move at all. There's three options. One, you can actually do a similar surgery. If the arthritis is not bad in that joint, you can do the same type of surgery as just a normal Hallux Limitus because you caught it early enough, and you can oftentimes get the motion back and allow them to get back to normal with normal walking and so forth. Number two, you can do some kind of an implant in there to recreate basically the cartilage in that joint so you can actually get the motion back as well. In that, you're remodeling, you're taking off all the bones and so forth. You also sometimes have to modify that joint so it actually functions like it's supposed to. And number three is doing some kind of a fusion in that joint where you actually fuse it so it can't move. That also eliminates the pain. Typically, when you're fusing it, you're going to fuse it in such a way where the toe is slightly up and slightly in towards the second toe towards the littler toes, so that it will fit in normal shoes and they can function like normal. We've actually had individuals where we've actually done that surgery and they still are able to run depending on the age and athletic ability of the individual. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 38, Hallux Limitus and Hallux